Hello. One of the patient who is having the renal failure, and from the renal failure he is having the dropsy all over the body. There is a swelling, dropsical swelling all over the body. With there is a lack of secretion of the urine. Urine बहुत कम हो चुकी है, और there is a rise of uric acid, urea, creatinine in the body. And the patient comes to me with that conditions. It suggests that there is a renal failure. There is hypertension as well as due to these renal conditions. All these conditions, the patient also had a hypothyroidism. With this, he had the renal failure. In this renal failure, we cannot prescribe by looking only that there is a renal failure. We should have the specific symptoms, the characteristic symptoms, on a detailed investigation, a detailed understanding of the general characteristic symptoms. One of the characteristic symptoms which I found is that the patient says, "No, doctor, my urine odor is of onion, strong odor of onion." मेरे जो पेशाब में है, यूरिन का जो स्मेल है, वो स्मेल आता है और वो स्ट्रॉन्ग स्मेल है ऑनियन के जैसा, समवॉट सड़े हुए ऑनियन जैसा या ऑनियन जैसा, और समवॉट गार्लिक जैसा. That is the striking point. That striking point suggests that it is uncommon symptom which is associated with the case. And in the homeopathic practice, we don't have to consider the pathology कि इसको renal failure है तो ये दवा दे देंगे, ये बहुत अच्छी दवा है renal failure की, ये बहुत ही कारगर दवा है, ये मैंने यूज़ की है. This is not the thing. What symptom, what characteristic symptoms is there in the literature, in the proving which is arises, that should be considered, and that is the remedy selection. That is essential for the remedy selections. So the urine odor, onion-like, urine odor, garlicky, with that there is a renal failure, and in that case this remedy is a cuprum ars, arsenate of cuprum, arsenate of cuprum, Shields green, in which it is written in the Borix Materia Medica. If you will go to the urinary section, renal insufficiency and uremia, garlicky odor of the urine. If it is with the diabetes, urine of high specific gravity, increased acetones and diacetic acid. This is also conditions. And if you will go to the repertory, you will see urine odor, onions, urine odor onion. It is given by Allen, Herring and Kent. Urine odor onion, cuprum ars, Allen, Herring and Kent ने verify करके repertory में दिया है. With that there is a gambosia and phosphorus is another also remedy. But the whole case is suggesting it is the case of renal failure, and the indicated remedy is the cuprum ars. I have prescribed that patient the cuprum ars in the 30th potency as it was available for to me. And after that his dropsical conditions removed, his uremic condition removed, urea level कम हो गया, creatinine level कम हो गया, uric acid कम हो गया, joints की complaints कम हो गई, even उसका thyroid का level भी कम हो गया, hypertension कम हो गया, and the patient is in the well condition. This is the classical, practical Hahnemannian understanding of the case. It is not the बड़े बड़े नाम करके भी लोग इस तरह से बता रहे हैं कि ये बहुत अच्छी दवा है रीनल फेलियर के लिए. अरे लेकिन कब और कैसे प्रिस्क्राइब करेंगे, ये हमारे प्रोफेशन में प्रोपोगेट करना पड़ेगा. उसके बगैर होम्योपैथिक रेमेडीज विल नॉट वर्क. द स्टूडेंट विल कम सी दैट हाँ रीनल फेलियर क्यूप्रम आर्स. अरे लेकिन इंडिकेशन ऑफ द रेमेडी मस्ट बी देयर. विद दैट इन दिस रेमेडी one another characteristic very useful remedy in the cases of influenza. If there is a gastric disturbance, there is a diarrhea, pain in abdomen, cramps in abdomen, cramps in the calves of the legs after influenza, gastric disturbance. If you will go to the gastrointestinal disturbance of influenza and typhoid के बाद में या influenza के बाद में, influenza मतलब viral COVID like symptoms, COVID is also a influenza, one kind of influenza. So अगर ऐसे symptoms, gastrointestinal disturbance after influenza, I have verified it, I have used it lots of the time. That is the Cupra-Mars. Nephritis of the pregnancy, toxamia of the pregnancy. प्रेगनेंसी में स्वेलिंग आने लगती है, शुगर बढ़ने लगती है, किडनी फंक्शन डिरेंज होने लगते हैं, अल्ब्यूमिनेरिया होने लगता है. दैट कंडीशन शुड बी कंसिडर्ड एंड दिस कुड बी द रेमेडी. Cupra-Mars, nephritis of the pregnancy associated with the specific concomitant symptoms. अगर रेमेडी का उसमें मिल रहा है, if you are finding the specific concomitant symptoms of that remedy for the case, in that case, then this is the remedy. Convulsion preceded by gastrointestinal symptoms. Gastrointestinal symptoms के साथ में उसको convulsion आ रहे, झटके आ रहे, as the characteristics of the Cupra. Cramps in the claves, as well as the convulsions, epileptic-like conditions with the gastrointestinal symptoms, मतलब gastric catarrh, diarrhea, pain in abdomen, burning in the abdomen, whatever may be, उसके साथ साथ उसको convulsion आ रहे, झरक आ रहे, झटके आ रहे, then this is also a Cupra-Mars. Tongue thickly coated, dirty brown, white metallic taste. Metallic taste, it is a characteristic of Cupra. Thickly coated, dirty brown, dry mouth, and skin icy cold, sweat, skin even when dry. Sweat and skin even when dry. Cold clammy perspiration of the intermittent nature. Cold clammy perspiration. This is also characteristic symptoms. Acne pustules on the face and crudoneuralgia, crudogenital region. Ulcers look like chancre, gangrene, carbuncles. These are the skin symptoms and the characteristic symptoms I have discussed. And this is the understanding, classical understanding of the Cupra-Mars. That should study in that way, so that the student can use it in a proper manner, judicial manner, rational manner, in the Hahnemannian manner. Thank you very much. This is Dr. Ajay Kamble, practicing classical homeopathy, Hahnemannian homeopathy in the Nagpur, under the banner of Healthy Life Homeopathy Multi-Speciality Clinic, Medical Square, Nagpur. If you want to study from me, you can consult me in my clinic. If you want to take treatment, you can also consult me. My number is 9921 808 779. Thank you very much.